What weird things do people put up inside of their bodies or down through the digestive system? How we get them out, I'm going to go through later on. My name is Dr Singh, your emergency medicine specialist. Let's crack on with it. In the emergency department, we see patients putting all different kinds of substances, objects of all different kinds of natures into their bodies. One of the most interesting things are people who put drugs into their bodies. They swallow them from the top end or they put them in through the bottom end in the different passages. The reasons why they do this is for mainly drug smuggling. They're called mules. This picture that you've been seeing up right here is a mule who's put drugs underneath of their own tongue. This was only picked up on a CT scanner. This person thought they could get away with it, but you cannot hide from this type of imaging. It's these little substances that you can see in red and white shown just underneath the tongue. Here on this body scan CT, you can see different objects put inside of the abdomen. Now, there are many different packets. You won't know what they are unless that person tells you exactly what they are, or unless you somehow manage to get them out. How we get them out, I'm going to go through later on. People will have these drugs inside of their bodies for such a long period of time, whether they're coming across on land, through the air, on aeroplanes, or on boats across the water. Now, the biggest problem is that those packets could break down. So you're wondering, how are these people brought to us in the emergency department? Well, because they are found at border control or they are found elsewhere by police, they're brought into us because of the high risk of these packets breaking. Now, when these packets break, you will have a massive surge and release of these drugs into the body system. What happens is it takes a little bit of a while because it has to be absorbed, it has to go through the normal metabolic processes within the body, and then you get it rising in the bloodstream. And then through the bloodstream, it will go to the brain, all the other different organs where it will have the effect. Now, you can imagine drugs such as cocaine, ketamine, amphetamines, all these different types of drugs which act as stimulants, drugs which act as depressants, drugs which are hallucinogenics, psychogenics. Some of these drugs have very nasty side effects, and some of those side effects not only can make patients become very unwell, but put them into very dangerous heart rhythms. They can make some patients stop breathing. They can also make patients hallucinate or have delusions to the point that they believe that they have superpowers, that they can fly, or that they are invincible. And what happens is they end up throwing themselves off of buildings or throwing themselves in front of vehicles. Unfortunately, what happens is they end up dying. And this is the reason why these patients are brought to us, so that we can get these substances and packets outside of their body before it becomes a problem. Here's a few CT scans looking at these substances from the side of the person's body, and this other one is showing it as if you were looking from head to toe from above. These types of people are swallowing many packets because they are wanting to sell them and make a lot of money. Unfortunately, some of these people are forced into doing this by the drug lords, and for these people it's a very unfortunate circumstance. Some of them may be threatened, families threatened, livelihoods threatened, maybe their only other option. Some are actually abused, some are captives of them. As doctors, we're not there to judge, we're there to help keep them safe and prevent anything bad from happening. Here are some more pictures that you can see of the packet shown on various CT scans as well as x-rays, and this is a picture of what the packet actually looks like. It's covered in a type of cellophane wrapping, and that is why it can easily be broken down by the digestive juices that are within the digestive tract. Just have a look at this colorized CT scan. There are hundreds of packets within inside of this person's abdomen. This person was caught for drug trafficking at an airport through a CT scanner. The person presented with abdominal pain, and therefore it led to a sequence of events that led them to having a CT scan, and that is how this was found. Here we are talking about 830 grams of cocaine. That's about 1.82 pounds. Here's an example of where an X-ray showed nothing, absolutely nothing that you can see on here. But when you do a CT scan, bingo, you can see exactly where the substance is. It's these spherical objects that you can see just over here. And here again on the X-ray you can see bowel obstruction. This is a complication of these substances causing a blockage within the bowel. And leading on to the CT, this scan shows exactly the type of obstruction that is occurring and the packets and exactly where they are. So the biggest question is how do you think we get these substances out of the body without causing harm? Well, the secret is we literally give them a whole bunch of laxatives. A whole bunch of laxatives, top end and bottom end, to force all these packets out. This is the most conservative management way. This means it's the least dangerous, it's the least harmful, it's the safest way to get these packages out. We give some quick acting laxatives in the hospital, but that does mean that we're going to have to sit and wait. So you might as well grab a biscuit, grab some tea, enjoy the wait. These are some really good biscuits. I'm joking. We don't actually have tea and biscuits. It's A&E. It's the emergency department. We got to crack on and see other patients. Eventually we will come back to this patient. You'll know when it's worked because the outcome is very obvious. Okay? The most commonest trafficked drug is cocaine, followed by ketamine. These drugs are absolutely nasty and have horrendous side effects. But those that take it, well, they think something different. The other problem is these packets getting stuck within the bowel. This causes bowel obstruction. These people are going to need serious bowel surgery to undo that. That might even leave them with a stoma. If you're not sure what a stoma is where the bowel is cut. It is brought to the surface of your skin on your tummy and you are left with a poop bag. That's right. That's called a colostomy or an ileostomy, depending on which part of the bowel it's done on. Not only that, you might be left with serious infections, which is called peritonitis. This can be lethal, sepsis and death. These things are no joke. No one should do this under any circumstance, and hence why those people who are left to do this might be there because of very unfortunate circumstances. And that is why it's our job in the emergency department as emergency physicians to get these packets out of these patients in a safe and timely mannerism. We literally make them poop this stuff out. That's the end of this episode. I hope you enjoyed it. I hope it was fun and I hope it was educational. Make sure you stay tuned. Like, share and subscribe. If not, no problem. You can go somewhere else. That's cool. I really don't mind. This channel is going to grow whether anybody likes it or not. My name is Dr. Singh, your emergency medicine physician. See you all next time. Stay blessed.